This video is intended to introduce the new nursing flow sheet that is being implemented on a few units of the children. This document will be replacing the existing one called Nursing Observation for Acute Illnesses. The goal of this new flow sheet is to have a more systematic process for nursing documentation, to reduce the duplication of documentation, and to decrease the time needed to document. This new document will be a 4-pager booklet. The first 3 pages are check marks by system, and the last 4th page is for extra nursing notes. One thing that I want to highlight is that the goal of this document is not to assess and fill every box available, but only what is necessary and appropriate for each one of your patients. If an assessment was not necessary and not performed, you can simply leave the box blank. The first section here is for weight assessment. The goal here is to highlight if your patient has gained or lost weight, according to the previous one. If your patient is not on a frequent weight check, this section might not be appropriate. You can leave the section blank and only document your weight on OASIS. The next section is for interventions and tests. The goal is to document things that will happen only a few times a day, for example, blood works, tests, imaging, consultations, etc. The goal is to have a quick visual of what happened in the last 24 hours. Then we have a sections for vital signs and pain assessment. Quite simple. We can enter a check mark or a star under the time when the assessment was performed if your vital signs are within the normal range or not within the normal range according to the age. You can refer to the legend at the bottom here that explains what the symbol and abbreviations are for. For the Pew score, you can enter directly the number that was obtained following your assessment. Same thing for pain assessment. You can choose and indicate which scale you have used directly and enter the number of the pain on 10 that was obtained during your assessment. Next, we have the pediatric pressure ulcer risk assessment. The goal here is not to replace the existing Braden scale tool, but is to highlight if your patient is at risk, when the next evaluation should be performed depending on the risk assessment, and a reminder for mandatory daily patients and family teaching. Same here for the risk of falls, is to highlight if your patient is at risk, the reason why using the protocol, and the requirement for daily teaching for your patients and family over here. Next section is for psychological assessment. Once again, is quite simple, and if you refer to the legend at the bottom, it should be quite self-explanatory over here. Here we have the respiratory assessment. You can see that this section is quite detailed and has a little more space for documentation. You can also notice here at the top, you have to enter your own time at which the assessment was performed. If we scroll down to look at the legend, you will notice how detailed it is, and your boxes are a little bit bigger in order to be able to add more than one abbreviation for each assessment, for the breath sounds or the retractions perhaps. The goal of this section is to be quite specific in order to stop using the extra nursing documentation tool that's called the asthma, pneumonia, and bronchiolitis to reduce duplication of documentation. Following the RESP section, we have the cardiovascular and integument sections. These sections are quite clear if you refer to the legend at the bottom. One little comment here for the stoma section is that we have created more space to be able to document if your patient has more than one stoma, a gastrostomy and an ileostomy, for example. Following on page 3, we have the gastrointestinal section. Once again, it is quite a simple section, and I want to highlight one more time that if the assessment was unnecessary for your patient, for example, an abdominal girth might not be appropriate for everyone, you can simply leave the box blank. The last section is our neurological assessment. You can see how the table and the legend at the bottom are quite detailed, with a full Glasgow Coma Scale assessment by age. The goal of this section is to stop using the extra nursing documentation tool called the Neuro Vital Signs. Once again, to try to reduce our duplication of documentation and have all the information in one document. The last page of this 4-pager booklet is for extra nursing documentation, for assessment that you were not able to document above, or for abnormalities that require more specific documentation, and as well the final plan at the end of your shift. If you do need more space for extra nursing observation notes, extra sheets will be provided on your unit. Don't forget that if you have any more questions regarding this new flow sheet, you can always refer yourself to your unit educator. The hope is that this document will make your days easier and gives everyone the desire to read you.